If you think that you might have dyspraxia, you came to the right place. I have a little test for you with a couple of questions, after which you will have a good indicator on whether you do or do not have it. To create this video, I used the DSM, which is where you find official criteria for diagnoses like dyspraxia or, for example, dyslexia. I also used the Adult Dyspraxia checklist, which is one of the few screening tools out there that can be used for adults. Movement and coordination difficulties are the essential features of dyspraxia, and officially it is called Developmental Coordination Disorder. This is how it's going to work. I'm going to ask you 14 different questions, all relating to symptoms of dyspraxia. The more oftentimes you answer yes, the more likely is it that you actually have the condition. Towards the end, there are going to be 4 additional criteria that are not optional, so those have to apply to you. Before we start, I would like you to know that this is not supposed to be a replacement for an official diagnosis. So let's get into the questions. First question, did you have delays in developmental milestones, like for example, sitting, crawling, or walking? Have people around you commented on your lack of coordination skills, or have they called you clumsy in the past? That's actually quite a common experience for people with dyspraxia. Question number 3, did you have difficulties with self-care tasks, such as tying your shoes, fastening buttons, or zippers? Would you say that at school you were not able to write as fast as your peers? Now, as a side note, if your coordination difficulties mainly have to do with writing, I would take a look at dysgraphia. As a kid, did you have difficulties building models or, for example, assembling puzzles? Question number 6, do you tend to bump into things? Maybe it's the corner of a table or something else. If so, that would be typical for people with dyspraxia. Do you avoid hobbies that require a lot of coordination skills or certain kinds of sports? And the next question, when you do perform tasks that involve a lot of coordination skills, do you tend to perform them more slowly than others? Now, would you say that this is happening more often to you than to other people around you? Maybe you also tend to get stains on your clothing. If so, then that would be another indicator of dyspraxia. Are tasks like shaving or doing your makeup difficult for you? Question number 11. Do you find it difficult to do 2 things at the same time? For example, talking and driving at the same time, or listening to somebody while driving? The next question also relates to driving. Did it take longer for you to learn to drive? Do you tend to have trouble articulating certain words or to adjust the volume of your voice? Now, also dyslexics sometimes have trouble articulating words correctly. Would you say it's kind of hard for you to fold your clothes and then to stow it away neatly? Next, we're taking a look at the criteria that are not optional. And the first one is that the symptoms have their onset in early childhood, meaning dyspraxia is not something that develops later on in life. The next 2 criteria both have to do with the severity of the symptoms. The DSM states that your ability to learn and execute coordinated motor skills has to be substantially below that what is expected of you in comparison to your peers. Another criteria states that the difficulties that you're experiencing has to be persistent, so you haven't really managed to get rid of them, and it interferes with your daily life. Now, it's kind of hard to actually determine if what you're experiencing is a variation of normal or if it already classifies as dyspraxia. But at the point where it's also affecting your mental health, meaning you have feelings of anxiety or embarrassment and shame around tasks that involve coordination, then I think it is safe to say that it would also be severe enough for the official diagnoses. And lastly, you will have to make sure that there's no other condition that is a better explanation for your difficulties than dyspraxia. So it would be a good idea to look into a condition called sensory processing disorder and also cerebral palsy and dysgraphia, because these conditions tend to get confused with dyspraxia. Now, if you would like to do me a favor, please write into the comments how often times you answered yes and if you have an official diagnosis or not. That way others can compare their own scores to someone with the official diagnoses. Okay, thank you for watching, and see you in the next one. Bye.